What is upper cervical care all about? Well, most people believe it's about chiropractic adjustments. It's really about the functionality of the most important place of your spine and body. How you guys doing? I'm Dr. Josh Henk. I am an upper cervical chiropractor here at the Transcendence Family Wellness Center in Sterling Heights, Michigan, and I'm here to share with you how the upper cervical care that we offer is different than other offices around the world. When you look at the upper cervical spine, while most people will not understand the terminology of cervical means neck. We're looking at the upper part of the neck. The upper part of the neck is considered the most important part of the spine and the whole body because of what's inside of it. This bone is not what keeps you alive, but it's the brain stem inside of this bone. And the brain stem connects to the base of your skull, your cerebellum, and the rest of your brain. So here's your skull, and here's the top bone in your neck. Inside of it is your neurology, and your neurology is our focus here at the Transcendence Family Wellness Center. Your neurology needs more than just spinal alignment. Yes, in addition to gentle spinal adjustments and physical rehab of the muscles around this area, that's all important. But in addition to all of that, we need to support this brain stem with proper nutrition, rest, and meditation. Okay, so when you have a neurologically focused wellness center, you're no longer focused on just one element, and especially with the upper cervical spine, we cannot care for just the bone. We cannot care for just the nerve. We cannot care for just the spinal fluid. We cannot care for just the arteries that go through these holes. Okay, we have to care for all of those things. But before we even begin caring for those things, how do we know if you need care of those things? And that's why the most unique part of the Transcendence Family Wellness Center and Upper Cervical Care here is that we have a specific diagnostic approach. Using thermography to detect heat changes, we're able to see if there's any inflammation or nerve pressure in certain parts of your body. And we use a medical grade camera to look at your entire body so that we can see where the nerves start all the way to where they end. We're also able to see on both sides of the spine how your nerve system is functioning. Okay, and we're using a diagnostic tool that is completely safe for pregnant women, for those who are sensitive to radiation, because we're not looking at putting radiation into your body. We're looking at what's coming out of your body. All right. And if your body's not at a balanced temperature, it's probably because these nerves or the arteries that are surrounding and giving you life are not working correctly. All right. So we want to begin with an examination, and a very scientific examination. If we see any nerve problems inside of your body, that's where we're going to see if you have any weight imbalance from side to side, and actually be able to measure the weight distribution between both legs, which should be between 3 to 5 pounds. We'll check to see if you have a shorter leg than one another. Whenever your neck is injured, your body will want to shift to keep itself level, but now your shoulders and your hips are off balance, and we can recognize that with a simple evaluation. Through all of that basic analysis, we may move you into having some x-rays done to find out exactly what position that bone is in. Some people, the bone is turned to the left. Some people, it's to the right. Some people, it's up. Some people, it's down. And some people, it's slid side to side. Most of us have a little bit of all three, which makes chiropractic care all the more complex, because it's not as simple as laying you down and twisting your neck. Okay, we have to take a strategic approach to it. And it just so happens that the adjusting approach that we make to this upper cervical spine, because we find out exactly the millimeter and degree, it doesn't have to include twisting, popping, or snapping or force. Okay, so very gently, no twisting, no popping, no cracking of the neck, we are able to move this bone into the specific alignment that it needs to be put back into. Okay, and everybody has a different misalignment. Okay, that's why every adjustment that comes into the Transcendence Family Wellness Center is different. Okay, once we put the bone back in alignment, we need to keep the bone back in alignment, and that's where it's important that we evaluate your muscular system. We evaluate your brain activity to make sure you're sending positivity through these areas, because stress will override the healing response. Okay, and then it will throw the bones out of alignment. So more importantly than just having your body put back in alignment it's making sure it stays in alignment. And that's what's so unique about our wellness center, because while most chiropractic offices may stop at the structural alignment and just look at your body on the physical level, we actually dig deeper and look at your body on the functional level. So we do further testing using things like thermography, which I mentioned, blood analysis, electroactivity analysis using a Zytoscan, and we're able to do stool sampling, urine sampling, hair sampling tests, saliva samples, all sorts of different types of science, so that we can get down to the root cause of what's preventing your body from healing itself. All right. You have to remember that the body heals itself as long as nothing's getting in the way. And where we need to start is right here at the base of the skull using upper cervical care.